This is Dr. Majid Jahangir. I am heading the Department of Radiodiagnosis at Government Medical College, Srinagar. And our this department, it caters not only to SMHS Hospital, to Super Specialty Srinagar Hospital, but also to 8 associated hospitals of Government Medical College, Srinagar, which include Bone and Joint Hospital, the LD Hospital, Nibhan Psychiatry Hospital, and other hospitals. And our department is located in all these hospitals. And we at SMHS and Shireen Bagh Hospital, we have got a state-of-art equipment. This equipment, most of this equipment was procured after the deluge of 2014, and we are especially thankful to our Prime Minister, Mr. Narendra Modi Saab, for providing us this high-end latest equipment at that time, which was very important for the revival of our department at that time. Radiology is the backbone of diagnosing and staging cancer patients, because at this our hospital we are having all the facilities for staging of cancers, which includes mammography, CT scan, MRI. However, more importantly is that we need to screen patients for cancer, and radiology is pivotal in screening for various cancers, which includes, we can screen, for example, we can screen lung cancer by doing a low dose CT scan. We at SMHS are having a high-end 3D mammography machine, the first of its kind in the valley. This machine has got the facilities not only for tomosynthesis, but also for computer-aided diagnosis. And we can also do stereotactic breast biopsy for confirming the diagnosis of breast patients. However, more important than diagnosis is the screening patients for breast cancer, because screening means that we have to pick up a cancer when the patient has no symptoms, patient has no problem related to breast, and if we pick up a cancer at that stage, this is 100% curable. So I will like to appeal to all our and encourage all the females above age of 40 years to please visit our department at Shireen Specialty Hospital, and please get an annual mammogram done regularly. One has to be aware of the warning signs of cancer, and one has to come to the clinician at a very early stage. Early diagnosis means cure. Late diagnosis means that not much can be done at that stage, and the patient has to suffer. Not only the patient has to suffer because of the chemotherapy and the radiotherapy options, but also the family has to suffer financially, and it is also a lot of stress on the entire family members. So this is a 3 Tesla MRI at Super Specialty Shireen Bagh Hospital. This is a very high-end equipment, state-of-art equipment, and we have been having this equipment since 2014. MRI main role is for imaging of brain, spine, spinal cord. Besides, it can also image abdomen, breasts, and all internal organs. It can also be used for doing angiographies of various organs. This patient we are presently doing is a female patient who has presented to us with the breast lump, and this MRI is being done for staging of breast cancer. And we can see that since the patient has not reported early, the cancer has spread to the lymph nodes in the axilla. So the main advantage of MRI is that it has, like ultrasound, it has no ionizing radiation. So there is no hazard of any radiation, both in ultrasound as well as in MRI. MRI, this patient is a elderly female, and this is the MRI of the brain we are doing, and you can see how clear the images are. It is as if we are taking sections of the brain and visualizing all the pathologies that are possible. MRI can also be, besides brain, MRI can be done in abdominal organs, for breast, and we can even do various angiographies. And the advantage with the MRI is that we can, unlike CT scan, we can get the angiography without giving IV contrast. Although there is a radiation in CT scan and plain X-rays and in mammography also, but the radiation hazard is always less than the benefit that the investigation gives to the patient. Always, whenever a radiologist or a clinician asks for an investigation, that time the risk benefit ratio is in favor of benefits to the patient rather than the risk to the radiation hazard. This patient has come to us for the diagnosis of insulinoma pancreas. They want to rule out an insulinoma of the pancreas, and you can see how beautifully we can see almost all the organs of abdomen, the lungs, the liver, uh, and here we have got the spleen, the kidneys, and the spine. So this is the advantage of MRI. It has an excellent soft tissue resolution. Now is a DEXA scan, bone DEXA scan, and it's also called as a bone density test. In this test, we measure the person's strength of bone because after the menopause in females or after age of say 50, 16 males, the bones become very fragile and brittle. They lose their calcium, and the chances of getting a fracture without trauma are more. Usually we see that patients in old age, they get fracture of hip without a fall, and then they have to go for surgery, and which are very extensive surgeries to prevent all those fractures. All males whose age is more than 70 years and all females with age of more than 65 years, they should undergo this DEXA at least once to know the strength of their bones. CT scan machine which we're having at Super Specialty Sittenberg Hospital is a state-of-art machine. It's a 256 slice dual source CT scanner and is the only one available in the whole valley. This is a very fast CT scanner, and the whole body CT scan just takes one breath hold, means just a minute. Besides doing all routine CT scans on this machine can also in a way freeze the heart, and we can do coronary angiography also on this machine, and pulmonary angiography, which are not possible on other CT scanners. Here we can see we are doing a patient of coronary angiography, and yet we are seeing what a beautiful image of heart and this blood vessel we can see. And this patient has no need to undergo digital subtraction angiography, which is invasive. So this is a patient we are doing a CT scan of chest and abdomen, and you see how fast the machine is. In a single breath hold, we can do the entire abdomen and chest.
14 seconds.
It just takes 14 seconds to do the whole body CT scan in this machine, and you can see how beautiful the images are, and you can even do all the reconstructions, including in any plane possible, including 3D reconstruction. You will see how fast it is scanning, and we are doing chest and abdomen within a period of less than half a minute. One single breath hold and the scan is over. This is the greatness of this machine. It is faster than the fastest jet in the world, and that is because of that we are able to freeze the heart, so to say, and take images of the beating heart, and we can do coronary angiographies on this machine, which is not possible in other CT scanners. This machine is also important for cancer patients because this has got a special software for cancer patients where it can calculate the volume of metastasis and volume of bony metastasis, and beside that, CT scan is the backbone of diagnosing and staging cancer patients. Any cancer patient needs all cancer patients, they need CT scanning for follow-up as well as staging of the malignancy. Once the patient is operated or given chemo or radiotherapy, even during the follow-up, he has to undergo routine CT scans. And this machine is a state-of-art machine, which is best for cancer patients also. In the digital radiography machine, we don't need to process the films or other things. The image comes directly on this monitor, and from where we can print the image or we can send it via fax to other parts of the hospital directly. So you can see in this X-ray, you can see there are kidney stones and a stent has been put in this patient. So this is our digital radiography unit. The advantage with this digital radiography is that the images are almost instantaneously on the screen, and we don't need to develop the films as in conventional radiography. And other advantage is that this image can be transferred directly to the clinician in the ward through PAC system, and this is referred as the filmless radiography. So the expenditure of the films can be reduced by direct transmission of films. However, the most important advantage of this digital revolution is that the machine is very fast. A lot of time can be spared by this digital technology, and the patient don't need to wait. You are seeing there are no there is no patients waiting outside because the images are got almost instantaneously, so the patient doesn't need to wait outside for getting his X-ray done. This is a digital subtraction angiography lab, or the DSA lab. It's a state-of-art biplane angiography machine, and on this machine we are doing various vascular as well as non-vascular interventions. In the vascular intervention, we are offering almost all vascular interventions except for neuro interventions, for which we are taking help from our colleagues in skills department, where we have got a dedicated neuroradiologist. Rest all non-vascular interventions we are doing ourselves, and this patient is a case of cast over the gallbladder, and his CBD has got blocked by the cancer, and so he has got obstructive jaundice. And to relieve the obstruction and to give relief to the patient, we are putting a biliary stent in this patient, and that will relieve his jaundice, and patient will have a comfortable life of the child.